Good morning. Welcome back into Wake Up America. I'm Rob Finnerty. Happy Wednesday to you. We've got some big news to report on right now. As we've known for a while, the CDC has not been great or timely with their data and information. This dates back to the Trump administration. COVID cases are falling nationwide, but the CDC recently revealed that they deliberately withheld COVID-19 data over fears of public misinterpretation. Imagine that. They didn't just withhold the data from you and I. They withheld the data from the entire medical community, which prevented them from doing research in a timely manner. For more, I want to welcome an expert on this topic, former HHS Deputy Chief of Staff and author of a fantastic book, Warp Speed, Inside the Operation That Beat COVID, the Critics, and the Odds. Paul Mango back with us this morning. Paul, so good to see you. You were right there on the ground in the Oval Office with the 45th president when Operation Warp Speed was launched. We know that CDC data has not been timely, accurate, or complete. You did something way back in 2020. You basically decided that HHS was going to bypass the CDC at that time. Why did you do that?
Well, Rob, thanks for having me this morning. And could you imagine a more patronizing statement than the CDC believing that the American public may misinterpret the data? But to your point, as you said, we found the data very quickly to be not timely, inaccurate, and not complete. So we created a workaround system that linked directly into basically every U.S. hospital. What the CDC was doing was collecting data from public health agencies, from state and county agencies. It was very late and incomplete and inaccurate. We went around them and created a system called HHS Protect under the Secretary's direction, and we had great data flowing in. What I've learned is that this administration gave control of that system all back to the CDC, and we are where we are, which is they have a culture of hoarding data because they want to be the ones who publish the research. It's a day late and a dollar short.
They want to get all the credit for it. So Joe Biden comes into office. He terminates your program. He gives the CDC back this power. Shouldn't the entire medical community have access to this information so we can learn as much as we possibly can about COVID as quickly as possible?
Yeah, Rob, exactly right. And I published an op-ed on this just a couple of weeks ago in early February, which basically said, why don't they adopt the principle that Operation Warp Speed did, which is the government enables the private sector to be successful. The government should play a role in collecting these data, because what we did was issue a temporary regulation that required all the healthcare providers to submit the data. That's important, but then put it into the public domain and let America's very talented hundreds, if not thousands, of epidemiologists and public health officials all analyze it at the same time, conduct their research, and then the role of the CDC should be to synthesize this research into policy. That should be their role, not to conduct the research. They're way too slow and they're way too irrelevant. By the way, I looked at their latest research papers. You know, one of them was just last week. It said, oh, how has the nature of emergency room visits for kids changed during COVID? And it said, well, there's been more kids coming in for injury and behavioral health issues. All right, well, and their advice to parents was be more vigilant. That's not exactly relevant and penetrating research as far as I'm concerned. So yes, let's let the public sector, or the private sector, conduct the research. The CDC should synthesize that into policy recommendations.
Absolutely. Recommendations is the key there. And by the way, that statement, over fears that the public might misinterpret the information. A CDC spokesperson said, and this is in that report, this is a quote, information was held back from the public in the U.S., quote, because basically, at the end of the day, it's not ready for prime time. Who are they to decide that?
Well, Rob, again, I can't imagine a more patronizing statement than that coming from a bureaucrat. And I know that these are very dedicated public servants, don't get me wrong, but they should understand that their role is not to determine what the U.S. public sees and doesn't see. Their role is to interpret the research that comes out of that data. And I think what's really going on here is there may be something that they don't want the public to see, not that they're afraid that the public will misinterpret it.
Yeah, and I think that the issue that we've had, and Tuesday it'll be March 1st, so that'll be 2 full years and 3 calendar years when it comes to schools that we've been dealing with this virus. And it's just the lack of quality information, misinformation, disinformation. Yeah. 2 weeks ago, the CDC released information about the effectiveness of boosters, and now we're hearing, talk of a 4th booster in the fall, right? So it's gotten totally out of hand. It's totally ridiculous. the report did not include the data for people ages 18 to 49. So basically all the information that we've gotten is totally inaccurate.
Yeah. Well, and I think you saw, Rob, I think this was a good sign. The FDA put a halt on the evaluation of Pfizer's vaccine for children under 5 because they thought it was insufficient data. So I think there's a number of studies, if you will, that are emerging that suggest that all of these boosters may not be necessary. And I think it's even contradicting data. Again, that's fine. That's what science is about. There should be different persons looking at data and evaluating it differently. That's fine. But let it all in the public domain and let everyone synthesize it, if you will, and determine what's right and what's wrong.
Paul, we appreciate the time. Just quick, about 5 seconds. Can the CDC, can their reputation recover from COVID-19? Because I think it's taken a permanent hit.
It needs a complete transformation, as we say in business, Rob. It's a cultural transformation. It's a leadership transformation. It's a data transformation. It's going to take a long time. It can begin that process, but I don't think it's going to do it under this administration.
Yeah, I agree. Paul, great having you on. Safe travels to you. We appreciate your time. Thanks so much.
Hey, thanks, Rob.
All right. Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, we're real news for real people.